Vital signs offer EMS providers a snapshot of the patient's current physiological status. While many EMS professionals learn to delegate the task of taking vital signs, it is essential not to take these results at face value. Accurate vital signs are crucial for patient assessment and can significantly influence medical decisions. Here are 5 ways to improve the accuracy and interpretation of vital signs. Avoid assuming systolic pressure based on pulse location. EMS providers are often taught to estimate systolic blood pressure based on the presence of pulses at specific anatomical locations. Radial pulse, 90 millimeters of mercury, femoral pulse, 70 millimeters of mercury, and carotid pulse, 60 millimeters of mercury. However, this assumption is not supported by research and should not replace a full blood pressure measurement. A palpable pulse can confirm that the patient has a heartbeat and some level of cardiac output, but it does not give an accurate systolic blood pressure measurement. Take a full blood pressure. Only measuring the systolic blood pressure, known as palpating a blood pressure, provides limited information. Blood pressure is a measure of the pressure in the arteries during both systole, heart pumping, and diastole, heart at rest. Obtaining both systolic and diastolic pressures allows the calculation of the mean arterial pressure map, which gives a better understanding of how well the organs are being perfused. A map of at least 70 millimeters of mercury is needed for proper organ perfusion, and anything below that indicates worsening tissue perfusion. Actually count respirations. Many EMS providers may assume a normal respiratory rate of 16 breaths per minute without accurately counting respirations. However, the exact respiratory rate can significantly affect the diagnosis. For example, screening tools for conditions like systemic inflammatory response syndrome rely on accurate respiratory rates. Additionally, noting the quality of respirations, such as deep versus shallow, regular versus irregular, provides even more insight into the patient's condition. Report if you cannot measure a vital sign. It's crucial not to confuse clear lung sounds with absent lung sounds. While providers often check for abnormal lung sounds like wheezes or rhonchi, the absence of any sound may indicate a serious condition such as pneumothorax or a misplaced endotracheal tube. It's vital to listen for both normal and abnormal sounds and to report accurately if lung sounds cannot be heard. Avoid using the term stable vital signs in documentation. Summarizing a patient's condition with stable vital signs can lose important nuances. It's better to provide complete and accurate measurements in both radio reports and turnover documentation. Additionally, obtaining multiple sets of vital signs over time allows providers to track trends, which can show how the patient's condition is evolving.